I'm Dr. Richard Abair. I'm an ear, nose, and throat surgeon here in Lafayette, and we're here to tell you more about our office at FYZICAL Lafayette. In an ENT practice, there are dizzy patients that show up every day, and we treat those patients to the best of our ability from a surgical or medical perspective. But oftentimes we hit a roadblock and there's nothing left that we can do. Physical therapy has always been a part of that treatment plan, but so often a physical therapist could only take our patients so far. When I learned more about physical and researched it, I was able to find ways that we can do a better job. Once I learned about the physical patented pathways and protocols and what they were doing for patients nationwide, it blew me away, and I knew that was something that I wanted to bring to our practice, and especially to Acadiana. All physical therapists are trained in balance therapy in their basic education to become a physical therapist, and I utilized multiple different therapists throughout 15 years before we got into our own physical corporate practice. During that time, I never had consistent management for these patients. Once we got into physical as a corporation franchise, we noticed that the protocols and the methods of treating these balanced patients were far beyond anything I'd experienced with any other patient. Once I saw this in action at other centers in other parts of the country, I knew we had to have it here. I had to have that for my patients to get them better. There is a difference between physical, FYZICAL, spelled different because we are different. All you have to do is look across over here and it says, love your life again. How many patients that you know in your family or in your community who are falling, who are dizzy, and their life is not what it was just a year, 6 months, or even 2 weeks ago? At our company at FYZICAL Dizziness Fall Prevention Center in Lafayette, our goal is to help you love your life again. Within ENT, our audiological services are really important for the patients that are also having dizziness and imbalance. So they go hand in hand when you're treating these patients. We always work up our patients who are dizzy with the hearing test first, then we go on to the diagnostic testing for balance. Then we move on to the physical therapy evaluations where we find a lot of other potential options for our patients. At our office in FYZICAL here in Lafayette, we have a full-service audiologist that takes care of all of your hearing needs in this community for my patients and our partner ENT patients. In addition to that, we have a full line of hearing aids that we sell, and we can do pediatric as well as adult swim molds and hearing testing.